Hello everyone, today I'm going to introduce to you the safe and competence management of chest drain. Chest drain is also known as underwater seal drain. Appropriate chest drain management is required to maintain respiratory functions and hemodynamic stability. Therefore, assessment of chest tube and cistern tubing should be done during every review. So, while reviewing the patient, check the dressing if it is clean and intact. Dressing should be changed when wet or soiled, loose, or any sign of infections, for example, redness, swelling, exudate. However, this procedure is a risk for accidental drain removal, so avoid unnecessary dressing changes. If to change dressing, after removal of the old dressing, check the drain insertion site for signs of infections as I mentioned before or any inflammations. Observe the suture remain intact and secure. Also, check for any subcutaneous emphysema and ankle remeasurement to ensure the chest drain is not dislodged. For chest drain dressing, you go with flaving lotions. First, cut 2 gauzes with 2 legs as shown at the pictures on the left. Then, cover the gauze overline each other at the chest drain insertion site as shown in the pictures on the right. Now, anchoring the chest tube securely. First, prepare 3 pieces of 3 long leg plaster. The first and the third stripe tap onto the patient's chest, while the middle stripe anchoring around the chest tube. Then the second plaster on the opposite direction using the same method. Repeat another time for the third plaster at the opposite direction of the second. Next, cut 2 pieces of 2 short leg plasters. Paste the first 2 short leg plaster at the opposite directions of the third plaster. Lastly, the second 2 short leg plaster at the opposite direction again. Ensure the tubing is tapped against the patient's skin like mesentery style. This is to prevent the chest tube falling up and also prevent the pulling of the drain. The chest tube should never be dislodged. In the event of such a catastrophe, pinch and hold the skin side closed while awaiting for suturing set to stitch closed immediately. Drain clamp or forcep is for use in emergency only in case accidental disconnections. Clamp the drain tubing at the patient's end immediately. Therefore, patients need to be taught on how to clamp the chest tube on their own. When clamp the tubing system, ensure use gauze to protect the tubing as shown in the picture. This to prevent the damage to the tube. Clamp chest drains only if accidentally disconnected unless clinically indicated like provocative or trial. This is a risk of the patient developing a tension pneumothorax if a drain is clamped while an air leak is present. In every review, check the tubing system as well. Tubing should have no damage, kink, or any obstruction in the tube that may inhibit drainage. Therefore, flushing may be needed if the tube is blocked. Besides that, ensure all connections between the chest tube and drainage unit are tight and secure with tape. Underwater seal drain bottles should always be below the level of the patient's chest and should be securely positioned in its stand or hanger. Ensure the water seal is maintained at all times. In this picture, the water seal is barely maintained. So, should turn the bottle 90 degrees clockwise to ensure the rod, which indicated by the red arrow, and submerge at least 2 to 4 centimeters in the water to create one-way valve for the air to escape. Next, the patient tubing should be connected to the rod that's submerged in the water, as I mentioned, which acts as one-way valve for air. And the picture actually shows the patient tubing is wrongly connected to the vent that functions to allow the trapped air to escape. Vent that indicated by the red arrow should keep open to allow the trapped air to escape and also prevent the pressure building up in the drainage system. It can also be connected to a low pressure suction if indicated. The chest drain chambers need to be replaced when it is 3/4 full or when the underwater seal drain system stability has been compromised, for example, accidental disconnection. Pain assessment should be conducted frequently because the chest tubes are very painful as the parietal pleura is very sensitive. Therefore, the patients require regular pain relief for comfort and to allow them to complete chest physiotherapy or mobilities. In summary, we have gone through some important practical aspects on how to take care of chest drain. However, we didn't cover chest drain charting, assessment of functioning chest drain, and chest drain removal. Do consider repeat the video and take some time to go through it. Thank you for staying until the end. If you find this video helpful, do not forget to share it and consider to watch our other videos classroom. See you next week.